I really believe that the home modalities, especially PD in my practice, allows patients to really be able to continue their standard of living. A lot of them continue to work. A lot of them have a purpose in life and are much happier. And I'd like to, continue to push for home modalities for our practice, and also to, spread the word that it's doable even in very difficult circumstances, and patients are very appreciative and do very well.
Having that trust really builds on how you can sometimes even direct or guide your patient to choose the right modality for that particular time in their life with the kidney cycle. So we're excited about home modalities, and we hope that this experience can be generalized and we can all learn from each other and hopefully grow in a modality that we all strongly believe in.
I have a couple of young patients who have, both of them, like each one of them, have 5 kids, and they still work and they do home hemodialysis, and they still get to do like their 4 or 5 treatments a week, and they're happy. They do it and they're compliant with it. I'm pretty sure they will not be able to do all that if they're, in center. So I think quality of life, continuing to work for sure is a big benefit. And they're generally healthier, and they do tend to stay out of the hospital more, and so they get to do other things as well. So.
We understand that dialysis doesn't mean this is your life. It means that it's part of your life, and that if we can facilitate any modality that can be done at home, that would be most comfortable for most people. You really have to have an understanding of where the patient wants to go with their lives and what they foresee in the future.
We see in our data that the rate of bloodstream infections for patients in center with hemodialysis catheters is actually higher than the rate of infections we see with peritonitis for patients on PD within the home settings. And additionally, in the midst of a pandemic, what better place to be than at home as opposed to having to travel to and from a dialysis unit, be exposed to multiple other patients and people coming back and forth. So home therapies are an area where we've seen within the company a much lower rate of COVID-19 than in our patients who are on in-center therapy and have a much greater challenge.